Good afternoon. I'm Allan Goldstein, Chief of Pediatric Surgery at Massachusetts General Hospital and Professor of Surgery at Harvard Medical School, and I'm joined by my colleague, Dr. Nandivada.
Hi, I'm Prathima Nandivada. I'm a pediatric surgeon at Boston Children's Hospital and assistant professor of surgery at Harvard Medical School.
We are both thrilled to share with you this collection of articles on Hirschsprung disease, a condition that affects so many children worldwide and has such a significant impact on their lives and the lives of their families. In the 140 years since Dr. Harald Hirschsprung first described the disease and the 77 years since Dr. Swenson offered a successful surgical treatment, the care of these children has evolved tremendously. Surgical management of Hirschsprung disease was once high risk and prone to major complications. Today, those risks are much lower. Our attention has shifted now to a deeper understanding of the pathophysiology of the disease, to new approaches to its treatment, and to improving the quality of life for these children as they grow into adolescence and adulthood. This special issue includes articles by leading authors from around the world and addresses the most important topics in Hirschsprung disease.
We have a collection of 11 articles that cover a wide range of topics, beginning with a historical review of our understanding as well as the surgical management of Hirschsprung disease. We then dive into the pathogenesis with a focus on development of the ENS or the enteric nervous system and how alterations in this process result in Hirschsprung disease. These changes inform the pathologic features of this disease reviewed in the article that follows. The key diagnostic principles are laid out, and I think will serve as a wonderful resource to us all. The next group of reviews discusses the current surgical management, with the first discussing the standard of care for short segment Hirschsprung disease, as well as some areas of active interest and research, namely the timing of reconstruction. The following article highlights important variants, including long segment disease, total colonic and small intestinal Hirschsprung disease, as well as some of the unique challenges of managing a patient with a later diagnosis. Despite our best efforts, complications still occur, and the next review instructs us on technical pitfalls during pull-through surgery with practical tips on how to avoid them. The pathogenesis, prevention, and treatment of Hirschsprung-associated enterocolitis, a dreaded complication, is the focus of the next review. It highlights some of the current scientific understanding, as well as some thoughts on prevention and treatment. This is followed by a paper discussing some of the controversies in the management of Hirschsprung disease. While there is some data to guide our management, there is much that is still debated among people with high volume practices. This includes how to manage transition zone pull-throughs and innovations around sphincter dysfunction in patients who have been operated on for Hirschsprung disease. Perhaps the most controversial are conditions that resemble Hirschsprung disease but do not firmly meet the diagnostic criteria. Our next review educates us on these allied disorders of Hirschsprung disease, discussing the presentation, some of the diagnostic criteria, and options for surgical and medical management. Perioperative complications for patients with Hirschsprung disease are much less common, but the long-term intestinal dysfunction and some diminished quality of life remain a major concern. The next review really delves into long-term outcomes through the lens of quality of life. There's a focus on genitourinary dysfunction, infertility, as well as how to think about persistent obstructive symptoms. Our final article discusses the new frontier for treatment for patients with Hirschsprung disease. It reviews some novel endoscopic microscopy options, as well as the use of artificial intelligence to enhance our diagnostic accuracy, and the potential for cell-based therapies to replace or augment missing elements of the enteric nervous system.
We're really thrilled with the special issue that has been put together. We thank the editors of the World Journal of Pediatric Surgery and the many authors who contributed their time and their expertise to put together this wonderful and informative issue. And we hope that all of you enjoy reading these.